Okay, so now let us look at one question here. Draw and label microscopic structure of thin skin. So they are asking you about what? Thin skin, and they're asking you to draw and label its microscopic structure. So they're not asking anything else. For 3 marks, what are they asking you? They're asking you to draw the microscopic structure and just label it. Okay, they're not asking any other explanation. So first, let us understand what is the difference between thick skin and thin skin. Then only we will be able to draw it, right? So in thin skin, you have hair. What do you have in hair? What do you have in thin skin? Hair. Okay, but thick skin does not have hair. But God gave thick skin something extra that is called as the stratum lucidum in the epidermal layers. Lucidum. Okay. So what does thick skin have? Stratum lucidum. What does thin skin have? Hair. Does thin skin have stratum lucidum? No, not so conspicuous. Thick skin, does it have hair? No, it doesn't have hair. Okay. So did you understand? So who has hair? Thin skin. That is what they have asked in the exam. So to draw it also, it is very easy. You just have to draw a hair follicle. Do not forget. So you will draw some kind of a skin layers like this. And remember, you draw a pit like this from which a beautiful hair will be coming out, which you can show in black, but already the background is black. So I'll show something like this. So you will show a beautiful hair and say that this is a hair. And around it, you will show all the other structures. With the hair, usually you'll have a sweat gland, right? And you will have a sebaceous gland which will produce oil, right? And you will also have a muscle called as erector pili muscle. Muscle I will show in brown or at some other color. There'll be a muscle here which will be able to make your hair stand straight when you get goosebumps. What do you call that? Piloerectus muscle. Okay. So here you can see in thin skin you have hair. Okay, so here also you can see some hair follicles. So this is thin skin. And what will you draw? You will draw this hair follicle, remember. And for this, hair you will remember. And for this hair follicle, you have got one erector pili muscle attached. You have a sebaceous gland attached, which will produce all the oil stuff and all. And then you should have some sweat gland also, right? Sweat also. Okay, same thing we are repeating. So here what you can see is a hair follicle. Right in the middle, they have shown one hair follicle, nice, and they have shown some layers of epidermis. We'll come to that. Attached to this hair follicle, you can show one sebaceous, that is oil gland here, erector pili muscle they have shown here, and then here they have shown a sweat gland. Okay, some other gland here, sweat gland, and so sweat gland, sebaceous gland, erector pili muscle, and this hair. Okay, this is very, very important to show. And when it comes to epidermis, you will not show stratum lucidum, remember. So they'll ask you to identify this in the microscope. It's rotated, okay, but you should still be able to identify it. See here, you can see the epidermis, right? And then here you have a hair space for that hair, right? Hair follicle, right? So here I can see some gland, could be a sweat gland here. Nice, right? So this is thin skin. You will identify this as thin skin. I'll show you thick skin microscopic slide, then you will be able to understand. So are you ready to look at thick skin? What will you not see? Hair follicle. You will also see some kind of a stratum lucidum. Okay, what is that? Let's look at this. This is thick skin. There's no hair follicle. And here you can see that in the epidermis, there is some kind of a light and dark band here, right? This light band is the stratum lucidum. The light band is the stratum lucidum. And the dark one is what? Okay, the dark one is actually stratum granulosum. Okay, it's granulosum. Okay, so just remember the layers of epidermis. You have cornea outside, right? Cornea always outside, right? C is outside. Then you have stratum basale at the bottom. Okay, base at the bottom, right? Basale, and you this is also called as stratum germinatum. For whatever reason, it's called a stratum germinatum. So it is going to give rise to the layers of that skin, epithelium. What am I saying? Epidermis. So this is stratum basale, germinatum. Okay. So cornea and basale you have understood. Middle what should be there? One lucidum should be there, right? That is the light band that you see. And then you see a granulosum, which is going to become the dark color. Granular. So it is dark. You can remember like that. Then you have one spinosum. It has some spine also. It is also called as Malpighi layer. Okay. Why is both marked as Malpighi? Okay, so you have these layers. So let's say from outside you have stratum corneum, lucidum, granulosum, spinosum, basale. Very important to remember these. So in thick skin you can see granulosum and the light colored lucidum. Lucid. Okay. Now how would you draw this? See, if you have to draw it, right, this is how you just remember the shape of cells. Cornea, very flat with circular nucleus. Then you have lucidum, which you can draw in lighter pink, and then granulosum with a little dark, because see, they have granules. Then you have the spinosum, right, and then you have at the bottom basale, which they have made a little columnar with elongated type of nucleus. Look at this diagram and we will try to draw it. Okay, it's just for 3 marks. So let's get started. So this is the outline that we have made. So here you have the epidermis. Here you have the erector pili muscle. Here you have the sebaceous gland. Here you have the prepared the sweat gland. Okay. So let's get started with the column basale. Okay, basale is columnar like the stratum basale is columnar. So you go on drawing columnar there, and here also similarly here you keep on drawing columnar cells. Okay. You get the point, right? Go on drawing columnar cells and fill it with the elongated nucleus. And then spinosum, you just draw some kind of a little circular kind of cells. And now coming to the granulosum and what is that? Spinosum and then the granulosum. And remember to draw a hair follicle, right? This is hair. This is not hair follicle. This is hair. Here you have the hair follicle. At the bottom here you have the hair follicle, right? This is going to be your hair follicle. So just see how you will draw the sweat gland and the sebaceous gland and the erector pili muscle. I'm not going to details of that. So now coming to one more thing that you can draw is in the skin. You can show something like this and say this is a melanocyte. Okay, melanocyte. This also you can mark. Fine. Is this okay? This is thin skin drawing.